Hello everyone. Today I'm going to discuss about the classification of the tumors. So in this topic, I'm going to cover the definition of the tumors, what are the cellular adaptations, difference between the normal cell and also cancer cell, and difference between the benign tumors and malignant tumors, the causes of the cancer, risk factors of the cancer, and how the development takes place in the cancer cell, and also the properties of the cancer cell, nomenclature of the tumors, classification of the tumors grading and tumor staging. So all these things I'm going to cover in this topic. So first of all, so what is tumor actually? So in nowadays, many people are suffering from different type of the tumors, also called a different type of the cancers because of the lifestyle change modifications and also so many health issues also leading to the cancers. So first of all, I'm going to discuss about what is the definition of the tumor. Tumor is nothing but is a extra mass development or abnormal mass of the tissue that forms when the cells grows and divide more than they should or do not die when they should. So that means, so if some cells are going to be die after certain time, so if it shouldn't means, so it may changes into the abnormal growth. Or if the abnormal growth is if not controlled in the cell development, so it may leads to the abnormal formation of the cell growth. So it leads to the tumors are also called as cancer. So all tumors may not be cancers. So it may be divided into two different type of the cancers. So one is the benign cancer and also one is the malignant. So benign is not a cancer, that means which is not spread to the other parts of the body, is going to be expanded where it is going to be happen. So these benign tumors may grow large but do not spread into and not invade a nearby tissue or other parts of the body. It's not exposed or it's not spread to the other parts of the body. But other type of the tumors, also called as malignant tumors, which are spread into the other parts of the body and also near, it invade and near to the tissues. Also, it spread to the near to the tissues. They can also spread to other parts of the body through the blood and lymph system. So these metastatic tumors is the malignant tumors. It spread to the other parts of the body, and also it travels in between through the blood as well as the lymphatic system. So that is the reason it's called as the neoplasm. Neoplasm means a new growth. So new growth development is because of the abnormal division or because of the abnormal development. So if there is no control in the cell development, so it may use the new development formation, so which is called as neoplasms. So simply we called as neoplasms, and tumors and cancers is the same. The name meaning is the same, but it's going to be different nomenclatures. So it depends upon the involvement of the site, the name will be different. So we will discuss how the nomenclature is going to be changed. So cancer is uncontrolled proliferation of the cells express varying degree of the fidelity to their precursors. So that means it's going to be exposed. So that's uncontrolled development of the cell. So if any divisions, if any cell is there, it's going to divide it into the multiplications. So if it's a normal cell is having then it's under control. But who are not under control, this may give excessive growth. So it may use the abnormal cell growth, leads to the cancer, also called as the tumor formation. So if you see the normal cells are going to be divided into so many. So for example, if you observe here in the normal cell, we having a cell membrane and also nucleus and nucleolus. So these and also cytoplasm. So all these things are there. If you see the normal cell, but in the abnormal cell, this is going to be altered. So that means the nucleus is also going to be changed, and also nucleus also going to be changed. And also other components of the cytoplasm is not in the proper shape, and also is going to be altered the shape, and also number of the cells are going to be increased. If you understand this image, we can understand so what is the cell. So if you see the normal cell, in the normal cell, we have the cell membrane, nucleus, and cytoplasm. In the cytoplasm, again, is going to the organelles are there. So here is going to be alter all the organelles and also cells is going to be multiplied. So if you see the cancer cells, so there is no control. These are many cells, the extra cells going to be formations. So if you see the individual, the cellular adaptations, so we can understand what are the different type of the cellular adaptations. So here we are going to if we discuss about the different types of the cellular adaptations, how the cells are going to be adapt, is going to be modified. So how the modification is takes into the cancer. So if you see the different type of, first one is the atrophy. The atrophy is the reduction of the number and size of the parenchymal cells of the organ or in its parts, which was once in normal is called as the atrophy. So that means if you see in atrophy, atrophy becomes the normal cells are going to become shrunken or becomes going to be small size. So because of the decrease in the blood supply, or decrease in the nutrients, or because of the any other disease progressions. So these cells are going to become very thin, so they become the small size. So that is called as atrophy. If you see the normal muscle, so in the muscle, see here, the muscle having the tension and also the minimal bulk in the muscle, if you see in the biceps. But who are having the muscle atrophy because of the muscle damage, the fibers damage, so it's going to get the weakness and also becomes very thin. So this is another one type of the cellular adaptations. So that means the cells are going to be changed their normal positions. So the normal size and shape is going to be altered. So that is the one type of the abnormality. So there is the atrophy. So this also changes in the cell. So coming to the another one, hypertrophy. Hypertrophy means is the increasing in the size of the parenchymal cells, resulting in the enlargement of the organ. So it is because of the excessive repetition of the workload on the muscle. So for example, who are doing the bodybuilding or who are doing the exercise with the weights, so is going to be increasing the like a resistance to the muscle, is going to give the enlargement. The muscle becomes like a bigger size. So because of the alteration in the activities, that means is because of the exercise or depends upon the or maybe nutrition or maybe supplements. So this also going to be alter the cell growth. So here the muscle bulk is going to be increased, so which is called as the hypertrophy. And also in the example, enlarged size of the uterus in the pregnancy. So that is the physiological. So in normally, if any after getting the pregnancy, so the uterus size is going to be increased, but that is the normal increase in the size of the cells. So that is the physiological changes. But in case of the hypertrophy of the cardiac muscle is a pathological one. So that means we're having some abnormality in the cardiac function. So abnormal cardiac rhythm or abnormal heartbeat. So may chance to get the hypertrophy in the heart muscles. So it is like a pathological conditions. So this also different adaptations, different changes in the one another type of the changes in the muscles. So the one muscle cell. So that is called as the hypertrophy. So if you do the exercise, automatically is going to get the increasing the size and shape. So it's a normal mechanisms. So it's a healthy who are going to be practice exercise as well as who are going to take the nutritious food. So automatically the muscle size and shape is going to be altered. In physiological one is going to be increase in the uterus, like increasing the uterus size in the pregnancy. In the abnormal, the cardiac musculature is going to be altered and also thicken or hypertrophy in case of disease progression. So coming to the hyperplasia, another type of the cellular abnormality is the hyperplasia. So hyperplasia means the number of the parenchymal cells resulting in the enlargement of the organ. So here is going to be, just now we saw, this is going to be, here is going to be the hypertrophy is going to be increasing, the parenchymal cells are going to be increased, the size of the only, but here the number of the parenchymal cells, if you see here, you can see the image, you can understand the difference between the hyperplasia and also hypertrophy. In a hyperplasia, the organ, the cells in the organ or tissue is going to be increased. But in hyperplasia, the number of the cells are going to be increased in the tissues. So that is so this is because of the abnormality. So these examples are the hyperplasia of the female breast at the puberty. So it's going to be altered. So during the puberty, the breast size is going to be increased. So because of the physiological changes, the breast size is going to be increased. So that also is a hyperplasia, but is the normal physiological hyperplasia. So it's going to be changed. And also during pregnancy and lactations, so these all are going to be, the breast size is going to be increased. in the pregnancy as well as the lactation, and also in case of the puberty. So these are the physiological one. In case of the wound healing, so in the wound healing, so what happened, the cell size is going to be increased. So that's the reasons during the wound healing, so may chance to get the swelling of the structure as well as may chance to get the scar formation. So that also is nothing but is a hyperplasia. And also the formation of the granulation tissue due to the proliferation of the fibroblast and also endothelial tissues. So endothelial cells. So these are going to be the formation of the granulation tissue. So that's the reasons we are going to get the healing process, healing in the, if any we get any damage in the tissues. So this is a pathological one. That is if any during the pathological one, in the healing process, you are going to get the swelling and also it's going to get the increasing the size. So that is called as the hyperplasia. For easily understanding, you can understand here, the normal size and shape of the cells are going to be altered in the hyperplasia. The number of the cells are going to be increased in the hyperplasia. So another adaptation in the cellular changes or cellular adaptation, that is called as the dysplasia. So this dysplasia is nothing but the broad term that refers to the abnormal development of the cells within the tissues or organs. So in abnormal development is going to take place in the tissues. So it can lead to the wide range of conditions that involve the enlarged tissue or the pre-cancerous cells. So then nothing but the size is going to be increased. And also if you see the not only size, if you compare the other the structure and shape of the cells are going to be altered. If you observe here, the normal cell having the cell membrane and also nucleus is in the center and also is the proper shape of the nucleus is there. But if you see here in the dysplasia, the alteration of the cell size and also shape is happened, as well as inside the materials are going to be is not in the proper shape and also size. It's going to be disintegrated. So that is the difference between the normal cell and also dysplasia. Coming to the microscopic alteration of the shape and size and organization of the cell. If you see under the microscope, the cell size and also shape and inside the organelles also going to be altered. So that is the main mechanism of the dysplasia. So this dysplasia, for example, if you see the cervical dysplasia. So most of the people think that cervical dysplasia is the like a cancer. This is also cancer. This is not exact cancer. This is the nothing but the pre-cancerous conditions in which the abnormal cell growth occurs on the surface lining of the cervix and also endocervical canal, and that is going to be opening between the uterus and also vagina. So if you see here, if you observe the cervix of the normal cervix, so which is located between the uterus and also vagina. So this part is nothing but is a uterus is the opening part of the uterus is called as the cervix. So it's going to be the normal condition. Is if you see the space in between the vagina and also uterus, the connection is called as the cervix. So opening is called cervix. But in case of the cervical dysplasia, so it's going to be alter the cell growth. So abnormal cell growth, the size and shape is going to be happening. So if you see the normal cell and size, so it's going to be the cell membrane and it's also the nucleus and also organelles are going to be there. But in case of the precancerous cells or cancerous cells, the cell number and size is going to be altered. So we can easily understand under the microscope, we can find the difference between the normal cell as well as the abnormal cell. So most commonly, this type of dysplasia we can find in the different type of the tissues in our body. So example is the cervical dysplasia is the most common conditions. So many people are going to face before the cancer. This is called as the precancerous conditions. So it is also called as cervical intraepithelial neoplasms. So neoplasia means is nothing but is the new cell growth, abnormal cell growth. And also it also sometimes associated with the sexually transmitted disease, which is called as the HPV, human papillomavirus infections. So this cervical dysplasia is most common in the women under the age of 30, but can develop at any age group. But most commonly seen in the age 30 years of age group. So especially you are having the infections such as the human papillomavirus, which is like sexually transmitted diseases. So may chance to get the abnormal cell development, cell growth, and also cell shape and size. So it's called as the cervical dysplasia. So another type of the cellular adaptation or cellular change is going to be the metaplasia. So this metaplasia is going to be, we can see in the so many different type of the cells. So it's nothing but this is going to be general pathology term. It refers to the process when one cell type is replaced by the another cells. So here in the abnormal cells are going to be development takes place, but the previous cells are replaced by the other cells. So that is the major problem in the metaplasia. So universally, the metaplasia is a precursor to low-grade dysplasia, and also which can culminate the high grade of dysplasia and also carcinoma. So that means this metaplasia is converted, the precursor means is before to the dysplasia, and also is going to convert it into the next one is the carcinoma. If it is the progression, is going to make chance to get the carcinoma. So it is improved the clinical screening for the surveillance of the metaplasia might lead to the better prevention or the early detection of the dysplasia and also cancer. So that's the reasons if you identify properly any abnormal growth or any other cells, so if you identify, we can prevent the carcinomas. So that is the reason screening is the very, very important if anybody having any symptoms before the cancer, or if you do any pre-cancerous symptoms, if you give the proper treatment, we can avoid and also we can prevent the a cancerous stage. So what cells are going to be replaced in the metaplasia? So if, for example, is going to one is the example in case of smoking, so which causes the mucus secreting ciliated, the pseudomonar epithelial cells are going to be involved, the respiratory epithelial cells. So that lines the airways to be replaced by the stratified epithelium. So if you see here, so this is the having the squamous epithelium cells in the respiratory tract are going to be replaced by the stratified squamous epithelium. So because of the smoking, so the smoking having they means having so many toxins. So because of this toxic material, so this because of the side effects of the smoking is going to be replaced by the abnormal cells. So is going to be the stratified squamous epithelium. So because of these cells replacement, is going to get the abnormal cell development, cell growth. So it again is going to divide it and also is going to progress into the cancerous cell. So are a stone in the bile duct that causes the replacement of the secretory columnar epithelium, and also if any causes or if any stone formation in the bile duct also may chance to get the, if we neglect and also if we are not giving the proper treatment, so these cells are going to be replaced and also may chance to get the cancerous cells. So that's about the metaplasia. So this also different type of the cellular adaptations in the cell changes or cell abnormalities. So coming to the next one is, what are the difference between the normal cell and also abnormal cells? So if you know the normal cells, so others, how the abnormal cells is going to function. So if any abnormal, so we can easily understand how the growth takes place in the abnormal cell. So if you see here, the normal cells are going to be is divided into the large, going to be the many. If you see the normal one, it's going to the mitotic divisions, which means is a one cell is going to divide into the two cells. And also here again, this one cell, two cells are going to divide into four cells. But if you see here, there is no the rules and regulation, there is no control. If from the one cell is going to divide into the multiplications, its around is going to be the hundred thousands of billions are going to be changed. So there is no control of the cell division. So increasing the cell number. So that is the normal cell between the normal cell and also abnormal cell, which is a cancer cell. So if you see the nucleus, the normal nucleus having this is going to be the normal shape and having the like a constant shape. But if you see here, this the abnormal cells in the cancer, the nucleus is going to become the large size, and also the shape also going to be altered. So that is the another important characteristics of the cancer cell. And also here, this going to be is the nucleus is going to be according to the cytoplasm ratio. So how much the cytoplasm is there, according to cytoplasm, the nucleus also going to be according to the size of the cytoplasm. But coming to the cancerous cell, we can see it's not according to the cytoplasm and also nucleus. So there is no ratio between the cytoplasm and also nucleus. And also, if you see this one, there is no size and shape is going to be totally altered. But if you see here, the proper size and shape is there for the normal cell, but in the abnormal cell or cancer cell, so it's going to be uncontrolled. So it leads to the size and shape also going to be altered. So if you see here, the normal cell having so many characteristics features. So the cell function, the cell transportations, and also absorption and also excretion. So all that takes place in the normal cell. So many characteristics of the cells are there. So, but here, so in the characteristics of the cancer cell, so all the functions are going to be abnormal. So it may lose all the normal cell features. And coming to the cells are going to be organized properly in the normal cell. So these in the cancer cell, these are going to be disorganized. There is no proper arrangements and there is no proper organization. And also, if you see here, if in the cell structure is there, in the so many cell boundaries are in the tissues, having the proper is the boundaries there, but in the tumors and also in the cancerous cells, so there is no proper boundaries to the tumors. So it's going to be the poorly defined the tumor boundaries. So exactly no, we cannot shape, we cannot give the size of the abnormal cells. If you see the normal cell, we can give the proper shape and size of the cell as well as the inside the organelles and nucleus. But this is going to be the abnormal and alter all the functions, so which we can see in the normal cells. So that is the difference between the normal cell and also cancer cell. So if you see here, the normal cells and abnormal cells, how the abnormal cells are going to be developed, and also is how it's not controllable. So that is the difference between the normal cell and also abnormal cell. So here, these two types of the tumors are there. These two types of the tumors are especially is the benign tumors and also malignant tumors. So benign tumors is not a cancerous tumors, but also it gives the complications if it is not controlled properly. It's not getting the proper treatment for the benign tumors. So if you see the benign tumor and malignant tumor, the differences, so at least we can understand what is the dangerous tumors and also what is the non-dangerous tumors. So if you see the benign tumor is not a malignant tumor, so which is the cancer, so it is also cancer, it does not invade nearby the tissue or spread to the other parts of the body the way the cancer. So that means it's also, it gives the abnormal cell growth, but it's not going to spread to the other parts of the body. For example, if anybody having tumor or a benign tumor in the chest region or maybe in the axilla. So because of this one is going to increasing the size of the tumor, but it's not going to spread to the other parts of the body, such as, for example, from the axilla to the chest, from the chest to the maybe neck, or maybe neck to the other shoulder. It's not going to spread. Only at particular part, for example, if the axilla, the tumor is there, is going to increasing the size of the tumor. So because of the increasing the size, it may use the space occupying to the other structures. So it may compress the surrounding structures, but it's not going to spread to the other parts of the body. So that is the main difference between the benign tumor and also malignant tumor. So in most cases, the outlook with the benign tumors is very good. It looks like we can see the shape and also size. But benign tumor can be serious if they press on vital structures such as the blood vessels and nerves. So just now we discussed. So it's not going to spread to the other parts of the body. It's going to spread or is going to compress the other surrounding structures such as the blood vessels or nerves or maybe any organs. So if it is compressed to the important structures, so it may use the complications. For example, if it's compressed to the artery, so it's going to decrease the blood circulation to the surrounding structures. Or if it's compressed to the nerve, it's going to give the decreasing the function of the nerve functions. It leads to the paralysis. So these are the complications of the benign tumors, but it won't spread to the other parts of the body. Coming to the malignant tumors, so these tumors are the cells that grow is uncontrollably and spread locally and distant sites. So for example, if anybody having a tumor or malignant tumors in the axilla, so it's spread to the breast and it's also spread to the lungs and may affect to the spread to the neck regions and also spread to the back. So all the parts are sometimes from these cells are going to be transmit to the brain. So this all the parts are also going to be affected because of the transmission of these cells through the blood as well as the lymphatic system. So these malignant tumors are cancerous, so which they invade other sites. So it's going to be affect to the other parts of the body. They spread to the distant sites by the bloodstream and lymphatic system. So this spread is called as the metastasis. So metastasis means the spread of the infections or the abnormal cell growth is spread from one place to another place, even though it's the distant sites. For example, if anybody get the damage or if anybody get the malignant tumors in the ankle region, so it may spread to until the brain. So this may spread to the blood and also lymphatic system. So that is the reason this tumor is called as malignant tumors. So you can see the difference between the benign tumors and also malignant tumors. So if you understand this image, we can easily understand about the difference between the malignant and also benign tumor. So for example, the benign tumors, so benign tumors are going to be, for example, this is the benign tumor. So here it's not going to spread to the other parts. It's going to compress, it's going to press the other parts. So it's going to space occupying. It occupying the other parts of the structure, other parts place. If, for example, this having the lung is affected, for example, any tumor in the lung. So if it is growing, if it grows, what happens because of the expansion of this tumor is going to compress the surrounding structure of the heart, or maybe surrounding to the downwards, maybe it's affect to the like a stomach, or maybe if any stomach in the tumor in the liver. Because of this expansion, it may affect to the other parts of the organs, such as maybe pancreas or maybe spleen or kidney. So because of the space is going to be occupying, space is going to be increased. Because of the space increasing, it may use the compression to the surrounding structures. So because of the compressions, so it gives the complications. Other than it won't give any complications. So for example, in case of the like a papilloma, that also one type of the tumor, but it's not going to give the much compression. Maybe it affects on the skin. So it may leave the little complications. And also it won't give any other complications. Simply we called as papilloma means if anybody having the warts, skin warts, maybe in the skin warts, we cannot, it won't get any symptoms. So, but, so for example, this is also like a one type of the, okay, this is also something like a wart. So most of the people are going to get this type of the warts, also called as like a, some skin warts are also called papilloma. Medically, we call it the papilloma because of the virus effects may chance to get the small enlargement of the like extra tissue growth on the so many on the skin as well as so many places in the eye, in the mouth, on the breast. So many places also going to get. So this is type of a tumor, but it won't give the complications, and also it won't give much. Okay, you can see here. So this also affect on the knuckles or maybe on the skin anywhere, but it won't give much complications. So in this condition, this type of condition, we won't get any complications. But inside, if anything, structure is going to be compressed like this one, inside any other part of if the surrounding structure is damaged, so may chance to get the nerve injury or blood vessel injury, any other structure complications may chance to get. So that is the main the difference between the benign tumors and also malignant tumors. So behind the malignant tumors, so it, for example, if the cancer is here, it is going to affect the other parts. It's going to hit the other parts, other structures of the body. So that is difference between the malignant tumors and benign tumors. If you see the changes, the physiological, pathological changes in the benign tumors and malignant tumors. So here you can understand the size is going to be increased in the benign tumors. So, but here is going to be spread to the other parts of the body, and also the size and shape of the cell membrane, and also nucleus is also going to be, and also it's not organized properly. If you see the nuclear variation in size and shape is going to be minimal. So here also is alters the nuclear size and shape, but is a minimal. But is going to be the very heavy, is going to be is a high variations in the size and shape of the nucleus. And also is going to divisions also going to be the diploid, and also is a range of the diploid. And also here also going to be the low mitotic count. That is normal mitosis. The division is going to be very low, but is going to be the abnormal mitosis. There is no control of the divisions. And also retention of the specializations, and also here is going to be loss of the specializations. So the cells are going to be not responding. And also is a differentiation, structural differentiations, and also is showing the structural differentiation shows the wide range of changes. It's organized, and also this malignant is not organized. And functional is a differentiation usually, and also is all the functional differentiation is going to all the loss. So all the functions are going to be normal functions are going to be lost. So that is the difference between the benign tumors as well as the malignant tumors. So that is the reasons malignant tumors are going to be very dangerous than the benign tumors. If we control the benign tumors, if we remove the causative factors for the benign tumors, so then we can control the symptoms. But malignant tumor, if we remove the tumor, still may chance to get the cells, if the divisions takes place, again may chance to get in the after removal of the tumors also may chance to get, after the recovery also may chance to get. So that is big difference between the malignant and also benign tumors. So coming to the what are the causative factors for the cancers, these tumors. So up to now, there is no exact causative factors for the cancer. For example, okay, if someone, okay, for one example is the smoking. For example, but if anybody is smoking, so overall smoking, all people are not going to get the cancer. Some people may chance to get, most of the people may chance to get, and others may not get. So there is not exact one causative factor for the cancers. So scientists believe that it is the interaction of many factors together to produce the cancer. It's a many factors. It's not only one factor. So that is the reason some people may chance to get the cancer who are exposing to the same causative factors, but they won't get the cancers. But who are getting the less exposure to the the risk factors may chance to get the cancer. So this depends upon the person to person vary, and also so many other factors also is together with it gives the other factors responsibilities. I may chance to get the cancers. So these factors may be the genetics and also environmental, constitutional characteristics of the individuals. So it depends upon the person to persons and also genetic involvement and also environmental and constitutional characteristics. So it won't be same for the everyone. And also this diagnosis and treatment and prognosis for the child cancer different than the adult cancer. So many different type of the cancers are there. So it will be different to the adult cancer as well as the children cancer. So the diagnosis and treatment and also prognosis, so it will be the totally different to the adult cancerous cells and also the children cancerous cells. As the main difference of the survival rate and the cause of the cancer. So overall 5-year survival rate for the children, the childhood cancer is about 80%. So they can survive until the 5 years is more than 80% of the children are going to survive. While the adults, the cancer survival rate will be in the 68%. So in the adults, so it is going to be a little bit percentage is going to be decreased. So the difference is that to be because of the childhood cancer is the most responsive to therapy, and also child can tolerate and more aggressive therapy compared to the adults and childhood cancerous. So who are going to get the childhood cancers. So the difference is thought to be because of the childhood cancers are more responsive to the treatment, and also adult cancers are a little bit less than the child cancers. If you see the childhood cancers often occurs is a benign in the stem cells, which are simple cell capable of producing other type of specialized cells that body needs. And also the childhood cancers are going to be respond easily to the treatments. But in the adult cells, so it becomes a cancerous, usually on epithelial cells. Epithelial cells lines the body cavities. So these epithelial cells are going to especially is located in the body cavities, such as in the body surface and regions. And also cancers occurs from the environmental exposures to these cells over time, because the body cavities are exposed to the prolonged time to the environmental exposures. So it may give the adult cancers. The adult cancers sometimes refer to the acquired for these regions. So that's the reasons. So these are going to be acquired type of the cancer. So because of the exposure. So what are the risk factors? So who are going to get these cancers is most commonly is exposed to so many factors, is not in the one particular causative factors. So such as the lifestyle factors. So in the lifestyle factors who are going to be exposed to the smoking is either active smoking or passive smoking. If the prolonged exposure to the smoking, it may chance to get the cancer. And also a high fat diet, especially the saturated fat, and also is nowadays many people are using the so many chemical food as well as the so many toxic foods such as all the oil fried foods. So it may use many people are going to use the oil many times by using the frying the many food materials. So this because of the burning so much of oil many times, so it may use the chemicals producing these chemicals may give chance to get the cancer. And also who are working in the chemical industries or who are exposed to the chemical products, so may chance to get the cancer. And also in most children with the cancer, however, too young to have to, who are having the children, childhood cancers also, who are exposing to these these materials, especially the smokings and also high fat diets, and also chemicals also, if a prolonged time if exposed, childhood cancers also may chance to get because of these lifestyle factors. And also another factors are the family history. In case of any family history, any genetic defects, so if any family members got the history of the cancer, or may chance to spread to the genetics, like in the genes, it may spread to the children's. And also genetic plays an important role in the some childhood cancers. So that's the reasons nowadays many childs also, the children are getting the cancer because of the, it may having the problem in the genetics. So that means who are already having the problem, so in the parents or maybe grandparents, so these genes may transmitted into the, like in the children, so they may chance to get the cancers. And also some other genetic disorders, especially is the Wiskott-Ehlrich syndrome and also Beckwith-Vedrim-Man syndrome. So these are the most common disorders are is related to the genetic immunodeficiency disorders. So these also may chance to give the cancers, especially in the childhood cancers. So these are also is going to give the extra growth of the tissues, and also most commonly they are going to enlargement of the big tongue you can observe who are having these syndromes. So these are some of the genetic disorders commonly you may chance to get a cancer, childhood cancers. And also certain viruses. So these viruses may chance to increasing the risk factor for the development of the cancer. So these are such as the Epstein-Barr virus and also HIV virus. So because of the HIV, may chance to develop into the AIDS. So these are going to be interlinked, and also developing the childhood cancers such as the Hodgkin's and also non-Hodgkin's lymphoma. It's related to the lymphatic system, like a cancers may chance to get because of these virus, especially is a EBV and as Epstein-Barr virus and also HIV virus. Possibly the virus alter a cell in some way, so it's going to alter the cells. So because of this alteration, so it may chance to get the cancer in the childhood. And also in case of if they exposed to any environmental toxins such as the pesticides and also fertilizers, and the power lines have been researched for the direct link to the childhood cancers. So who are being exposed to the fertilizers and also pesticides, and also who are the high lines and also power lines, especially the high metals exposure, or maybe who are in case of if anybody get the treatment cancerous agents, if exposed to those medications also may chance to get these cancers. So there has been evidence of cancer occurrence among the non-related children in certain neighborhood or also in cities. So if anybody is, if they are staying in exposed to chemicals or the strong pesticides or maybe fertilizers, who are just living near to any companies related to pesticides, may chance to expose to these chemicals will get the childhood cancers. And also this whether the prenatal or also infant exposed to these agents that causes the cancers. So if before the mother, for example, if the mother exposed to these chemicals such as the pesticides or fertilizers, also may affect the child and also may chance to get the cancer. So because before the prenatal as well as the postnatal, so if they exposed to these chemicals, so they may chance to get the cancer. So how the cancers, how the normal cell is going to be converted into or develop into the cancer cell. So normally just now we discussed, so after the development, after the division of the cells, that means the division is going to be abnormal. So there is no control of the divisions. So because of the cellular adaptations, so it may alter the cell growth and also cell shape and size. So first they're going to be happening in the changes in the DNA. So the genetic material is going to be altered. So the function is going to be divisions and also the shape and size is going to be changed. So after the change must cause an alteration in the cell growth and behavior. So this is the genetic material DNA. So because of the genetic material, so it only controls all the cell functions. So and also the behavior also going to be depends upon the DNA. So if any abnormality in the genetic material, so automatically is going to give the cell growth and also abnormality in the growth as well as the behavior. The change must be non-lethal and also to be passed into the daughter cells. So it's going to be affect to the other cells. So alteration in the more than one gene, so automatically is going to be alter all the behaviors in the cells. So it may gives that the gene is concerned are is oncogenes, the tumor suppressor genes. So it's going to be affects these genes. The sequence of the gene alteration from the normal to is a benign to malignant. So it's going to be changes into the normal cell, then benign cell is going to convert into the malignant cells. So, and also so many other factors also there is the intrinsic and eccentric factors and inherent and also environmental key factors. So many factors are going to be influenced from the normal cell is going to change into the abnormal cells, which is also cancerous cells. So many changes have takes place. Maybe you can learn all these changes, how the changes are going to be happening. So you can learn clearly in the pathological changes in pathology. So here we are going to discuss about what are the different type of the cancer cell, how this is going to be changed. So how the surgery is going to be, the surgery, how we are going to treat it with the surgical procedures. In the surgery subject, we are going to discuss. So about the properties of the cancer cells. So these are going to be the so many different properties. Just now we discussed he's having the benign tumors and also malignant tumors. So this is going to be two types of unique properties of the cancer cells. So one is the ability to invade locally. So that means is occupying to the surrounding structures, is extending, is spreading to the other parts of the body, and also capacity to metastatize to distant size the cancer spreading. So from one place to another place. For example, if anybody get in the cancer in the toe, may chance to get the effect to the brain. So that means it spread to one area to the other area through the bloodstream as well as the lymphatic system. So this is the cells, the main cancerous cells having the ability to shift from one place to another place, and also it automatically invade to the main feature of invading. That means it's going to be spread to the other parts of the body. So that is the major properties of the cancer cell. So how the spread is going to be happening? So in the benign tumors and also malignant tumors, how the spread is going to be happening. So if you see in the direct extension, so the benign, the carcinomas begins as the localized growth. First is going to get the localized growth, and also direct seeding body cavities or the surface when they arise. So that means first is going to affect to the where is going to be located. For example, it's located in the forearm. So first is going to be affected in the located, and also its surrounding structure is going to be affected. So after that, in the early cancer, do not penetrate the basement membrane. So it's going to be the carcinoma in situ. So that means where the carcinoma started, exactly their place is going to be expanding. So after that, if the cell progression is abnormal growth, from there is going to invade to the other parts of the body. So that means it's expanding to it's spread to the other organs, from other organ and also other site of the body. For example, in the abdomen, from the abdomen, it's spread to the other parts of the, for example, liver, it spread to the gallbladder and as pancreas or maybe spleen. But some is going to be this from here is going to affect the lungs. From the lungs is going to be affect to the brain. So it is going to be the distant site, very distant places also is going to spread through the blood as well as the lymphatic system. So when in the situ, the tumor acquires invasive potential extend directly to the compromised neighborhood cells to metastasis. So that it's going to be spread to the one part of the body to the other parts of the body. So for example, is a peritoneal carcinomatosis. So, and also is going to be the metastatic ovarian carcinoma. So it's going to be the peritoneal is going to be stomach. Again, it's going to spread to the ovarian. So it's because of the spreading of the malignant tumors to the other parts of the body. And also in case of the metastatic spread, so metastatic spread means it spreads the transfer the malignant cell from the one side to the another. So not directly connected. So this is going to be affect to these properties, malignant tumors, bring them into the contact with the blood and lymphatic vessels. So this hematogenous metastasis and lymphatic metastasis. So this, for example, if anybody having the problem here, so if this is spread to the brain and this spread to the other parts of the bone and liver, kidney, so it's going to through the blood and also lymphatic system. So this type of spread is called as the metastatic spread. So this metastasis means spreads from the one place to another place through the bloodstream and also lymphatic metastasis. So this is the spreading may happen because of the metastasis. So how the nomenclature, how the name is going to get the tumors. why we are going to call different type of the tumors names in going different. So this is depends upon the involvement of the structure, and also depends upon the involvement of the tissue is going to be involved for the cancer. So for example, so any tumors, so any benign tumors, for example, so any tumors is all the tumors are going to be suffixed with the oma. So oma means like a cancer. So oma to the cell origin. So for example, if it is affects to the papilloma, so papilloma means it affects to the oma. The papilla is going to be affected. The skin is a papilla is going to be affected. So that's why we call it as papilloma. Oma means like a cancer, is either tumor or also is, so especially for the benign tumors. So for example, the papilla is affected. So the name of the cell is papilla. So the character, morphological characters, and also oma. So there's a reasons we call it the papilloma. So these are often known as the warts and also varicose, and also when they reach to the skin. So that is nothing but extra growth on the skin is called as papilloma. So these are going to be, for example, some examples of papilloma on the skin, and also maybe any, and also sometimes we are going to get in the eye regions also the papilloma is going to be increased. So because of these things, it won't give much complications. But if it is occurs in the eye region, so it's going to be occupying the space inside the eye. So it's going to give the further complications. So it may chance to may growth. So it may damage the is a retina and sclera. So all the eye structures are going to damage. So may chance to get the complications, severe complications. If it is the peripheral regions, for example, on the knuckles, so on the maybe body surfaces, it won't give much complications because of it won't give any compression to the surrounding structures, such as the blood vessels, and also in the artery, in the blood vessels and nervous system nerves, peripheral nerves, it won't give much complications. And also you can sometimes it may chance to get in the palate, soft palate also, it may chance to get pharynx, and also this papilloma may chance to get, and also in the breast also may chance to get. So many places also may chance to get. So these are some examples of the benign tumors, but it's not, it won't give much complication. If it is there inside the eye or maybe mouth or in something, this may chance to get the complications. So these are the nomenclature will come, the tumors of the squamous epithelium. So is called as the epithelioma. So if the involvement of the squamous epithelium, so we call as epithelioma. Epithelium is involved, and also we are adding the oma, epithelioma. And also, for example, if the gland is involved, is an endocrine gland. For example, is a endocrine, is a adrenal gland is involved. So if the adrenal gland is involved, so we call as adenoma, adrenal. So adenoma we call as, and also lipoma. So lipoma and also fibroma, chondroma, osteoma, papilloma. These are some examples of the tumors. So for example, lipoma means the fat tissue is going to become like a rounded structure. For example, this is the line that is a fat tissue is going to become the hard and also rounded structure. It's extra growth. So it's a oma, like a cancer. This is a benign tumor. It's only is going to fat cells are going to be accumulated. So that is an example. That's the reasons we called as this is a lipoma. The fibroma, or fibroma means in case of may chance to get in the breast, in the female, in the fibroid tissues and the breast, as well as the ovaries also may chance to get. Is also it won't give much cancerous symptoms, but because of this benign like a characteristics, is going to compress the structures, and also it's going to compress the other alter the hormonal balance. So that's the reasons they will get the hormonal imbalance. So it leads to the some other complications, such as they may having the menstrual abnormalities, and also pregnancies, alter the pregnancies. They may won't get the pregnancies. So these may chance to get the other complications. So that's all about the how about the name is going to be related to the involvement structure. That is called nomenclature. How is going to get the nomenclature? So coming to the nomenclature for the malignant tumors, so these are going to be, if it is involved in the mesenchymal tissue, so we call it the sarcomas. So just now we called as the epithelium, we called as epithelioma. So is it related to the in the malignant, especially for malignant, in case of the mesenchymal cells involved, so is called as sarcoma. So if the epithelial cells origin in the malignant tumors, this means spread to the other parts of the body, especially for the epithelial cells, we called as carcinoma. Here in the epithelial cells, what we are calling, in the epithelial cell, we are calling epithelioma. So that means we can understand which one is the benign tumor and which one is the malignant tumor. So if the benign tumor, So that means we are going to call it the epithelioma. But the same thing, if it is the malignant one, we are going to call as the carcinoma. So that is the difference between the benign tumor as well as the malignant tumor. And also name of the origin cell, morphological character, and carcinoma. So that is the carcinoma or sarcoma we are going to give. For example, in case of the malignant tumor of the stomach. So here what we are going to call, so stomach is a gastric. So we call it the gastric is an adenocarcinoma. So it's a adenocarcinoma. So it's going to be affect to the, so that's carcinoma means is going to be epithelial cells are going to be involved. And also is the adenocarcinoma of the stomach. So maybe we can call another name for the gastric, the adenocarcinoma of the stomach is also same. So we can easily understand this is related to the, like it's related to the malignant cancer. So after seeing this one, we can understand. So that's the reasons the name, the nomenclature, that means the name is different for the like a benign tumors and as also is a malignant tumors. And also some special nomenclatures. So we are going to observe in case of, for example, blastoma. So this blastoma means the tumors are ringing in the immature tissue or nervous tissue. So if related to the nervous tissue involvement, so it is called as blastoma. So in case of nerve involvement, nervous tissue is the brain. So that is the reasons. Examples are the medulloblastoma. So and as retinoblastoma, nephroblastoma. So it's related to the medulloblastoma means it's related to the nervous system. The retinoblastoma is the eye is going to be involved, and as nephroblastoma, nephro means going to be related to the is a kidney. So these are all related to the cancerous cells, and also in case of the brain. So these blastomas are means is going to be ringing in the immature tissue. So these are going to be most often in the malignant. So most of the all the malignant in case of retina or nephron and also brain, medulloblastoma. So these, for example, the examples are these tumors are going to be suffix going to be oma. So these are also malignant. But just now we discussed if any oma is there, we thought that we are going to be benign. No, some oma is suffix also having the cancerous, that is malignant tumors. So which are is the tumors in the liver we called as hepatoma. Hepatoma means is a malignant tumor, but the ending also is going to end with the oma. Normally, it is going to, we can commonly seen in the benign tumors. But some cancerous tumors also, the name itself, it is called as the hepatoma. The suffix is going to be oma. And also melanoma. Melanoma means that's a carcinoma for the skin. That is a seminoma. We call it seminoma. And also lymphoproliferative tumors is also a lymphoma, also called as the Hodgkin's or also non-Hodgkin's disease. And also malignant proliferation of the leukocytes, like the leukemia, like the white blood cells, that is who are having the malignant cancers in the blood leukemia, that's blood cells. So that is called the leukemia. So these are some different names of the like involvement of the structures and also involvement of the type of the malignant cancer, the name will be different. So that's if you understand, so after seeing the name itself, we can understand what type of the tumors. So while assessing the, while reading the like in the investigation procedures, so if we get any report related to these like a malignant or benign tumors, at least we have to understand also what type of the like a malignancy. And also some other like a special nomenclatures. So these are going to be this derived from the one from the one germ layer may undergo different differentiation creatings. So it's going to give the different layers are going to be involved. So according to that, they are going to get the different names. So for examples are the teratomas. So these teratomas are rare tumors that may hold different type of the tissues such as bone, teeth, muscle, and also hair. They are mostly found in the ovaries, testicles, and also tailbone, but sometimes grow in the nervous system and also abdomen. So a teratoma may be cancerous, benign, depending on its structure. So these are going to be different, like a mixed one. There's going to be, so which layer is going to be involved? So most commonly, so it's going to be seen in the bone and also teeth, muscle, hair also going to be involved. So it's most commonly found in the ovaries in the females and also testicles in the male and also tailbone. So these commonly seen in the nervous system as well as in the abdomen also. So these are the different like a type of tumors we can see and also we can found in the so many people. So that's the reasons we have to understand about the what is the name of the what is the name of the like a tumors, is it benign or is it malignant. So here, so many other classifications we can see. So it depends upon the involvement of the cell, tissue origin, and also what type of the malignant, is it malignant or benign tumors. So for example, if you see the classifications, the tissue origin and also benign tumors, what we are going to call, and in the malignant tumors, what we are going to call. So for example, squamous epithelium involvement. In the squamous epithelium, so here in the benign, if it is involvement in a squamous epithelium, in the benign tumors we call as squamous cell papilloma. The same if it is the malignant, that means if it spread to the other parts of the body, it is called as squamous cell carcinoma. Same is there is a oma is there, but we are going to add the carcinoma for the malignant one. The same thing is the transitional epithelium. So is going to the transitional cell papilloma and transitional cell carcinoma. Glandular epithelium we call as adenoma and also adenocarcinoma. So this tissue is going to be different and involvement, the name is going to be different. So that is the difference between the nomenclature, the name is the benign tumor as well as the malignant tumor. And also coming to the involvement of the basal cell layer of the skin, so is going to be the basal cell carcinoma. And also is a neuroectoderm, we call as the benign tumors and nevus, and also melanoma, skin cancers. And also hepatocytes, liver cell adenoma, and hepatoma. Hepatoma means like a cancer cell in the malignant, in the liver. And also placenta is a chorionic epithelium. So if the placenta involvement, so we called as hydatiform mole and also choriocarcinoma. So these are the different names, involvement of the different structure of the tissue, different type of the tissue involvement. So in case of like a adipose tissue, we call as the lipoma. Adipose tissue, that's a fat tissue. And also liposarcoma. Sarcoma means it's the cancerous. And also adult fibrous tissue, fibroma, fibrosarcoma. So if it is fibroma in the tissue, in the breast or maybe ovaries, it won't spread to the other parts of the body. It's going to come. But here sarcoma may spread to the other parts of the body. So may chance to get the other complications. This next one is the fibronic fibrous tissue, myxoma, myxosarcoma. So oma is there, here sarcoma is there. So it's going to be the cancerous one. So cartilage is going to be chondroma, chondrosarcoma. Bone, osteoma, osteosarcoma. Synovium, synovium, and also synovial sarcoma. So here is a smooth muscle is going to be a leiomyoma and also leiomyomosarcoma. Embryonic fibrous tissue is a rhabdomyoma and sarcoma. Same is going to be added. So if you see the name itself, we can understand. So is it the cancerous cell or is it the benign cancer? Like that, so many different type of there is a from the non-epithelium. So it's a mesenchymal tumors. So mesothelium is going to be mesothelioma, and blood vessel angioma, say hemangioma, and also angiosarcoma, lymph vessel lymphangioma and lymphangioma sarcoma. The glomus is the glomus tumor, and also meninges is meningioma or is the invasive meningioma. So this also, if we had the name will be different. Is a hepatopoietic cells is going to be the leukemias, is a cancerous one, is malignant. Lymphoid tissue is a pseudolymphoma, malignant lymphomas. The nerve sheath is going to be the neurolemoma and also neurofibroma and neurogenic sarcoma. Nerve cells are going to be ganglioneuroma and ganglioblastoma. So this is sarcoma, carcinoma, blastoma. Related these terms, these names are related to the malignant type of the cancers. And also, if you see the other classifications, the mixed tumors are going to be salivary glands, is a pleomorphic adenoma, that is a malignant mixed salivary tumors. And next about the tumor of the more than one germ layers. So it's going to be the totipotent cells in the gonads or in the embryonal rests. So this one is going to mature teratoma and also immature teratoma. So this is going to be especially for the ovaries and testes may chance to get this one. So it's going to be a benign and malignant. So these are so many different type of the classifications. So and also different type of the names we can observe and also while assessing the patients. So according to the patients, so if we give the proper investigation procedures and also the biomarkers of the tumor biomarkers, so we are going to identify the what type of the tumor. So if we give the treatment according to tumor, the radiation therapy or chemotherapy and surgical management, so depends upon the causative factors. So if we remove it, we can prevent the seriousness and also we can prevent the mortality and we can give the rehabilitations. So that means we are going to bring back them to normal if we clear the abnormal cell. So that's all about the today's topic about the tumor classification. what are the tumors, what are the different type of the tumors, and also how the tumor nomenclature is there, what is the difference between the benign tumor and also malignant tumor, and also normal cell and also cancer cell. So we discuss now. In the next class, we are going to discuss about what are the characteristics of the tumor, and also what are the next to the stages, and also about the gradings, and also what are the staging and the tumors we will discuss in the next class. Hope you understand in this class. If you have any doubts, you can send me a message. In the next class, we discuss about the characteristics of the tumors, and also grading of the tumors, and also stages of the tumors. We will discuss in the next class. Thank you very much. See you in the next class.